Hi everyone! Menstrual pain, also known as dysmenorrhea, affects millions of women every month. While it's often considered normal, intense or recurring pain could be a sign of an underlying issue. In this video, I'll explore the causes, symptoms, and treatment of painful menstruation. First, what exactly is dysmenorrhea? It's the medical term for painful periods and occurs when the uterus contracts to help shed its lining, causing cramps and discomfort. There are two main types: primary and secondary dysmenorrhea. Primary dysmenorrhea usually begins during adolescence and isn't caused by any underlying disease. Secondary dysmenorrhea, on the other hand, often results from medical conditions like endometriosis, fibroids, or pelvic inflammatory disease. Common symptoms include cramping in the lower abdomen, pain radiating to the lower back and thighs, nausea or vomiting, diarrhea or loose stools, and fatigue and irritability. So, what causes this pain? Painful menstruation is primarily caused by high levels of prostaglandins, hormone-like substances that trigger uterine contractions. In secondary dysmenorrhea, causes may include endometriosis, where tissue similar to the uterine lining grows outside the uterus, fibroids, non-cancerous growths in the uterus, pelvic inflammatory disease, adenomyosis, when uterine tissue grows into the muscle wall, and the use of IUDs, especially copper ones. Doctors diagnose dysmenorrhea based on medical history, a physical exam, and sometimes tests like pelvic ultrasound or laparoscopy if secondary causes are suspected. But don't worry, there are several ways to relieve menstrual pain. Over-the-counter pain relievers like ibuprofen or naproxen, hormonal birth control to reduce prostaglandins and lighten periods, warm compresses or heating pads on the lower abdomen, exercise and yoga to increase blood flow and release endorphins, and dietary changes like reducing caffeine, alcohol, and processed foods can help. Medical treatments for underlying causes are also available for secondary dysmenorrhea. If menstrual pain interferes with your daily life or suddenly worsens, it's time to see a doctor. Early diagnosis and treatment can improve your quality of life. Dysmenorrhea is common, but manageable. With the right care and awareness, you don't have to suffer in silence. Share this video to support others and promote menstrual health.